Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. Mental disorders affect men and women worldwide. According to the World Health Organization, people who face adversity and circumstances such as violence and poverty are at high risk of developing mental health conditions, including depression, anxiety, and stress. Medical experts say men and women can develop most of the same mental disorders and conditions, but men are less likely to seek help compared to women. Societal expectations and traditional notions of masculinity often discourage men from accessing mental health support. Mental health remains a topic shrouded in silence, carrying a stigma on men in African societies. Juma Majanga reports from Nairobi how negative perceptions on mental health disorders are affecting the war on mental health illnesses in Africa.
Nairobi businessman Stephen Odhiambo Oluoch says his mental health struggle, compounded with feelings of loneliness during his university days, led him to drug addiction. The father of two recalls how his heroin addiction led him to drop out of college and brought him near suicide.
Got me to a point where the risk of death is no longer weighty. It is okay. We become almost like daredevils. You can do whatever it is you think to do because the consequence is not really relevant.
The World Health Organization defines mental health as a state of mental well-being that enables people to cope with life stressors, realize their abilities, learn well and work well, and contribute to their community. Dr. Frank Njenga, one of Kenya's leading psychiatrists, says men's mental health is in dire state the world over. He says one of the factors that makes men vulnerable to mental health issues is that they tend not to express their feelings as openly as women do. Dr. Njenga says the problem is even bigger in Africa.
Culturally, our sisters and mothers are allowed, nay, encouraged to speak out their thoughts and feelings. Men, on the other hand, are discouraged to show what society calls their weakness. And therefore, when the pain of anxiety, when the pain of depression, when the pain of just being a human being comes onto you, our society tells you, you're a man, don't show it, bottle it up. And bottle it up, of course, means take alcohol, take drugs, and so on.
Stigma around mental health illnesses is still a challenge, especially in Africa.
It's our culture that needs to allow men to openly describe, number one, acknowledge the feelings particularly of depression and weakness, but secondly, and perhaps more equally, to go out and seek help.
Statistics show that men are less likely than women to seek support from mental health providers and are 4 times as likely to die by suicide compared to females who suffer from mental health disorders. Oluoch and Njenga say Africa has made strides in addressing the problem, but more needs to be done.
Because we are so precious and valuable and have a responsibility, we need to be in the right mental space. We need to be healthy. We need to be thinking well. And we need to continue to stay well because we are a pillar of the society.
One of the key responsibilities of a man is looking after their families and their communities. However, you can only be an effective father and husband when you first look after yourself.
Experts and advocates are calling on the world to raise awareness on the importance of mental health among men and to encourage men to speak up and to seek support for their mental health issues. Juma Majanga, VOA News, Nairobi.